Okay. Hi, honey.
Montgomery Boulevard.
Oh my gosh. Yeah, that's my husband, and we are arriving at Chemo, number 5. One more to go. This is my hospital right here, mobile infirmary. That's him right there. And
show him this.
And this
we were
right
supposed to be there at 10:30.
Yeah, Kevin didn't drive fast enough.
World record.
All right. I gotta go. So now we're in the doctor's office. Hi. And we're waiting to be seen and have my blood drawn. Can you? Hi.
I see you.
Hi. And all is good. And yeah, my husband tends to get into things.
Just checking. You know how close you got to having your ears looked at a second ago.
Yeah. So anyway, it's all good. See?
There's a whole drawer of gloves.
Well, should I lift my other arm?
If this don't work, we'll lay you back.
Why isn't it working?
Do you have a question, Natasha?
Do that.
I do have a question. Pickly, yes, please. So I lost my nose hairs.
Did you?
Yes.
Great.
We'll miss them when they're gone.
It was the weirdest thing. Like looking at them, thinking, "Oh my gosh, that's so weird."
I was curious where they are.
But I still have my eyelashes.
Blood work looks good.
Does it?
Yes.
Okay.
I know last time you were a little bit anemic. It's perfect today.
Is it?
Yes.
I mean, this time I feel really, really, really good.
Good.
Yeah.
Any breast pain or changes that you can tell?
Nothing.
All right.
I mean, nothing at all that I can tell. And quite honestly, I haven't really been checking too much because I just, like, I don't want to know. I don't want to know.
I think in your case we'll use an MRI. Like after we get that 6th treatment in, we'll do the MRI. Just have them compare because they've got the measurements from what it looked like before. I think there were 3 separate areas that they had measured. So we'll just look at that and see whether any, what's still there, what looks smaller, what,
I mean, I mean, I can hardly find it. So that's why I just
I agree. Yeah.
Looking.
I wouldn't worry about it. Done. She's really new here, so I would have to ask her exactly what she does.
Well, it's surgery that's done right when they're doing the doing a lumpectomy, and they actually do something to this side too to make it look like this side. Yeah. But you get to, it's kind of a plastic surgery type thing done right then and there. But
she does it all instead of 2 separate doctors and 2 separate procedures.
And then you can actually have radiation after this particular procedure.
Okay.
Which I hadn't heard of, because usually don't you have to wait till
usually.
So anyway, but everything I read on it says that it's not really good for women with little breasts, and I don't know if I'm considered little or not.
Okay.
So what do you think, Kevin? No.
Seem bigger.
Perfect. So will I see? I will meet with the guy, whoever does
radiation.
Yeah. Before I start that, do I have a? Okay. Okay. Okay.
So, assuming things go well, you end up with a lumpectomy. You will meet with the radiation doctor after surgery, after you've healed up. You'll have an appointment with them. They'll look over all your records and say what their prescription for radiation would be. There's a couple of different ways that they do it. There's some short courses, some that are standard, typically about 6 weeks.
Okay. Okay.
Yes.
Will they take this out when I get my surgery, or do they?
They can go ahead and take it out.
Okay, good.
Yeah. No need to put you through another procedure. For sure.
Oh, I can't believe I have one last one.
Almost there.
What? Am I allowed to have a little party? Can he bring me champagne? No. Do you guys allow that?
I'll allow it. Yes.
That to me is a celebration. You know, at that point. But okay, cool.
Okay. All right. Let me get your labs for you.
Okay. Thanks. Okay.
Oh, goodness.
This is where we go. Hi. and yeah, these are Belinda. And we have over here Susan.
Hi, how are you? Good morning. Good morning.
Thank you. And this is the lovely room, and there's nobody here right now, so I can videotape it. They all had to go somewhere and be back. So, awesome. And we're getting started at right around 12. Steroid takes about 15 minutes.
15, and then the amend will be about 30, so about 45 minutes on our pre-medication.
Okay.
You can decide about your hamburger, how much you really want.
I know. I was like, he said he won't leave me, and it's.
Well, we'll just have to get this done. You'll have to eat lunch and supper all together.
Oh, I don't know about that. Today's going to be. We're going out to eat too for dinner. Yeah.
Okay. Well, maybe save up for that. Alrighty. Can I get you anything else? You guys settled in?
We're good. Yeah.
We're good. Thank you.
One of the nausea medicines?
Yeah, with that.
Lunch.
Maybe that was just
Transient thing. Are you feeling it now?
a little bit, but not bad. I mean, it's always like that.
Is it?
Yeah, so it's fine. It's not
Almost
anything
like
that's
a short of breath or something?
short of breath. When you take a deep breath, and you feel that like smog feeling in your lungs a little bit heavy, but yeah, I didn't know.
Not to my knowledge, necessarily.
Tell her that you're a hypochondriac too. See if that solves the problem.
I think that we just become more aware.
Yeah.
Sensitive to everything that's going on.
Yeah.
Absolutely.
Okay, so which one is this again?
This is the adriamycin.
Adriamycin. Okay, and what kind of side effects go with this one? I'm trying to figure which one's.
Nausea is probably associated with this more than some other drugs that we might get.
Okay.
Of course, the hair loss.
The hair loss. This is the culprit?
Well, all three of them actually cause hair loss.
Okay.
That you take.
Okay.
But this guy is, very notorious for that, very much so. Fatigue. This one, often can have effect on the blood cells. But yours are doing great.
Yeah.
Yeah. They really are.
Yeah. I'm excited about that. Yeah. Definitely feeling tired right now.
Yeah.
I wasn't feeling tired coming in.
There's a lot of stuff going in there, bud.
Yeah.
Yeah. You got this one, and then you're taxing, so, a couple more hours, thereabouts.
A couple more hours, Kev.
Yeah.
So I guess we could take a nap.
And he can take a nap, because we got all these empty chairs.
Kev, you got a chair.
So he can have a chair and watch TV
Yeah.
over there, and find some foreign football on the TV, whatever it is they got,
Okay, well, this one's called again.
Cytoxin.
This one's the cytoxin, and the last one is
Taxotere, this is the last one.
the last one.
It goes for an hour, and this is the one we do the 15-minute test, those first.
Oh, okay.
Now we're leaving. All right. Heparinase, we can do that there. Belinda, you coming with lemon drop?
Yeah.
Okay.
We had a patient that donated these.
That's so sweet. Oh, yeah. That's perfect. Thank you. Oh,
They knew right where you were coming from.
I
And
go.
a little scripture, so each one of them has their own little
Oh
scripture on there. Ain't that cute?
Prayer changes everything. Pray without ceasing. Oh, yeah. That is
Thank you.
You're
adorable.
welcome. Ain't that sweet?
Just like the one who makes these packs.
Yes.
So much love.
Yes.
So much love.
This is the on-body Neulasta, which means you carry it home on your body, I guess.
And that helps me with.
Help your white blood cells recover from the chemotherapy.
Does it go? I mean, your white blood cells are what are created in your bone marrow, or is it? So is that why it goes into? You feel it in your bones like that? And
Well, that's why patients will sometimes have bone pain with the Neulasta, because of all that hard work going on in the bone marrow.
I do feel
Making
it.
all those white blood cells, particularly the large bones, the bigger bones, make them ache.
I do feel it. That
Those legs, those arms.
It's kind of amazing.
Oh, yeah.
If you think about it,
Oh, yeah. The brilliance, huh?
Really?
People. Yeah. So it's supposed to start about, there it goes. Yeah.
Ah!
That's the way.
Oh, you know, it's like a rubber band.
Yeah,
Just like,
yeah, popping it, and then it pops back in.
all right, just want to get the time here. All right. Yep, and it's done for today. Hi. Good morning. It's the day after my chemo, and I just want to share with you guys how I'm doing this morning. I don't feel like myself, so I'm not gonna, I'm gonna be honest. I feel drugged up, very full. My whole body just feels full and just not like me. But I'm no major side effects right now. A little bit nauseous, so I'm drinking my green tea and ground up ginger, and that seems to help. And then the next thing that I'm going to do that's going to help me get through this day is I am going to go out there and go for a walk, because that really does tend to help me quite a bit, just getting up and being active. So, and then of course at 6:30 or so, this thing goes off, and then I'll have a few days of feeling that is what really kind of gets me, because it goes right to your bone marrow and just really kind of, it hurts, just hurts your bones and makes you tired. But, I'll get through that too. I just wanted to share this a little bit so you knew kind of what Happy saw yesterday. Just wanted to let you know how the next day afterwards. Now for some people it's different. I can't say why it's not like that for me. I do know I wake up in the morning thinking, all right, it's another day, let's get up. I'm not just going to lay here all day and sleep. Though, I will find myself back in laying down and taking naps, and especially after the shot goes. I mean, yeah, I do tend to sleep a lot during those times, so it happens. But still gotta look at life and how wonderful it is, and just know that those moments are moments that will pass. They'll pass, and they do. So anyway, thanks for listening, and have a great day.